So after diagnosing diabetic retinopathy, now come to the treatment part. For mild retinopathy, no active treatment is required, only control of blood sugar, strictly blood sugar control for mild retinopathy, because in mild cases there is no visual deterioration, no complication, nothing. Just 1 or 2 dot blot hemorrhages seen on the retina, which is harmless and it is stopped there if proper treatment is done at right time. Now for moderate to severe retinopathy, what is the treatment? Anti-VEGF. That culprit VEGF, vascular endothelial growth factor. You have to antagonize that culprit VEGF, anti-VEGF, because that factor, that vascular endothelial growth factor, it is causing all the problems. What problems? Creating new vessels. Those vessels are very bad vessels. Those are not good vessels. Those vessels are fragile vessels, abnormal vessels, and this factor is creating all those problems. And this is the main problem for the diabetic retinopathy. So, to antagonize this factor, inject anti-VEGF injection where? In the vitreous cavity. Right? These injections need to be repeated. It depends on progress. It all depends on recovery, progress, and all the parameters. Okay, so anti-VEGF. So there are many anti-VEGFs. Ranibizumab, bevacizumab, all those anti-VEGFs. Next is laser photocoagulation. When to do the laser photocoagulation on retina? It is done to stop the leakage from the blood vessels, because leaking blood vessel is causing edema, retinal edema, macular edema, and the vision is deteriorating because of the macular edema. So, photocoagulation, laser is given focally or pan-retinal also. Focally means macula, sparing the fovea. Laser spots are not put on the fovea, so sparing the fovea. Lasers are put around the macula, that is known as focal photocoagulation. Pan-retinal photocoagulation, when the whole retina is involved. So, pan-retinal, whole retina is photocoagulated. So, it all depends on the extent of the retinopathy. Next is vitrectomy. In case of vitreous hemorrhage, you have to clear the vitreous. You have to clear that blood inside the vitreous, otherwise the person will not see properly. Then for retinal detachment and fibrosis, surgery is required for retinal detachment. These are the treatment for the complications. Now, prevention of diabetic retinopathy. Yes, it can be prevented by regular eye checkup, monitor vision changes. Diabetes should be controlled, strictly controlled. Modifying lifestyles, medicines, or insulin. By these methods, diabetes should be controlled. Then reduce the risk factors like stop smoking, control of hypertension, high cholesterol, always regular exercise, then some antioxidants, and retina should be checked periodically by dilating pupils. Some eye screening camps occur, so those camps are to be attended by the patients. So most importantly, the earlier sign and symptom of visual deterioration. Yearly eye checkup is mandatory if the patient is diabetic, in spite of having good vision, because in early stage, the vision will be very good. So, in spite of good vision, person is diabetic, we should have a thorough eye checkup.